Hi guys, it's lecture time and it's Friday. So we've been talking about communication. We've talked about verbal communication and we've talked about nonverbal communication. And today we're going to start with written communication. So the key thing to remember about your written communication is you need to make sure that it can be easily read and that you use a permanent ink. Do not use any type of erasable ink, and make sure you follow your facility's policy and procedure as far as the color of the ink. Some places uh, only want black ink. Um, some may allow blue. However, just make sure that you're following whatever policy is at your facility. But you definitely cannot go wrong with black. Okay. Moving on, we're going to talk about patient identification. Correct patient identification is essential. Essential, essential, essential. It is a must, you guys, in order to reduce and prevent medical errors. And the process should be very well documented. So the Joint Commission recommends using at least 2 ways to identify patients, neither of which should be the patient's room number. Okay, when taking blood samples or administering any type of medications or blood products. And you want to not rely on a patient's room number because staff change patient room numbers often. For example, you may have gotten a requisition to draw labs on Mr. Smith in room 257. However, before you was able to get to room 257, Mr. Smith had requested to be moved to another room. And so now Mr. Jones is in 257. So you want to make sure that you do not rely on the patient's room number as a way to identify your patient. You want to confirm the patient identification by a 3-way match. So first you want to check that test requisition and the labels. Check the patient's identification armband. And if you're in a clinic type setting or a mobile type setting, that patient may not have an armband. They may have some type of identification card. Whichever is being used as a third check, you want to make sure you ask the patient to verbally identify themselves to you. Identifying patients in the ambulatory or home setting. Your identification procedures must be well documented, especially for homebound patients, uh, patients who visit the mobile vans or any of the off-site locations. The identification information may include demographic data such as the patient's ID number, their date of birth, their address, their phone number. You want to confirm all of this information prior to any lab draws, okay? So here's a big clinical alert. The patient should always be asked, "What is your name?" Not, "Are you Mr. Smith?" If you ask them, "Are you Mr. Smith?" this invites a yes or no response. And it's very important not to do that because patients, if they're heavily medicated or if they have some other type of disease process going on, such as some form of dementia or something like that, they may just answer you yes or no. Okay? Or they usually will agree with whatever you ask them. So we're going to stop there, and your assignment is going to be, you have an order to draw labs on Mr. Smith. How will you make sure that you draw blood on Mr. Smith and not Mr. Jones? Okay. And I will see you guys next lecture. Yay, it's Friday. Have a great weekend.